All right, today we're going to take a guided tour of one of the most incredible powerhouses in the human body, the anterior thigh. I mean, this is a region we use literally every single day, so let's dive in and see what makes it work.
Seriously, have you ever stopped to think about what's actually happening in your leg when you walk, run, or climb a flight of stairs? It's this incredible, intricate system of muscles, nerves, and vessels. But how is it all organized? Let's break it down.
So, here's the first thing to get your head around. The thigh isn't just this one big jumble of muscle. Nope, it's actually a super organized structure. You can almost think of it like a city with three very distinct neighborhoods, and each one has its own unique job.
And there it is, 3. The thigh is neatly packed into 3 functional compartments. And this separation, this organization, is the real secret to how the thigh works so efficiently.
Here's a quick look at that blueprint. You've got the posterior compartment in the back, which is all about extending your hip. You have the medial compartment on the inside, which helps pull your leg inward. And then you've got our focus for today, the anterior compartment. Its main gig is extending the knee, and it's all powered by the femoral nerve. See? Each neighborhood has its own specific purpose.
Okay, so let's zoom in and take a walk through that anterior neighborhood. This place is a true powerhouse, responsible for some of the most basic, fundamental movements we make. Let's meet the key players, shall we?
First up, you have the absolute star of the show, the quadriceps femoris. Now, this isn't just one muscle. It's actually a team of 4 that work together. Every single time you stand up from a chair, kick a soccer ball, or pedal a bike, you are firing up your quads to straighten out your knee. They're a big deal.
Next on our tour is the Iliopsoas. Now, while the quads are handling business at the knee, this muscle is the powerhouse for flexing your hip. Anytime you lift your knee up towards your chest or march up a steep set of stairs, it's the Iliopsoas that's doing all that heavy lifting.
And then we have this really unique, kind of ribbon-like muscle called the sartorius. It has a great nickname, the tailor's muscle, which comes from that old-school cross-legged position tailors used to sit in. But what's really cool about it is its dual action. It's the only muscle in this whole group that helps to flex both the hip and the knee, a real multitasker. Okay, so now that we've met the muscles, let's explore a really critical landmark in this area. It's a space that is so jam-packed with vital structures, you could almost think of it as anatomy's own Bermuda Triangle, a place where all the major highways converge. And this space is officially called the Femoral Triangle. It's not just some abstract idea. It's a real, physical, triangular-shaped depression high up on your inner thigh, and it acts as a major gateway for all the supply lines that are heading down to the rest of your leg.
So what actually forms this triangle? Well, the top border, or the base, is the inguinal ligament, which is a tough band of tissue you can find in your groin. Then the sides are formed by 2 of our muscles, the sartorius on the outside and the adductor longus on the inside. Together, they create this perfectly protected channel.
And the traffic that's passing through this channel, it is absolutely essential. We're talking about the main power line, the femoral nerve, the main fuel lines, the femoral artery and vein, and key parts of your immune system's highway, the lymph nodes. Pretty much everything the leg needs to survive and function has to pass through this one small triangle.
Now, believe it or not, within this already critical triangle, there's an even more organized little structure. So let's zoom in one more time and look at a special passageway called the femoral sheath. This sheath is kind of like a tight sleeve that wraps around the main artery and vein, but it's also neatly divided into 3 smaller subcompartments. And check out how organized it is. You've got the artery on the outside, the vein sitting in the middle, and then this third, even smaller compartment on the very inside.
So this third innermost compartment is known as the femoral canal. And yeah, it might be the smallest of the 3, but its clinical significance is huge. And it's not really about what it contains, but more about what it represents.
And here's why it all matters. This small, almost empty-looking space is actually a point of structural weakness in the wall between our abdomen and our thigh. So because it's a natural opening, it creates a potential pathway for stuff from the abdomen to actually bulge through, which can sometimes cause a lump or pain in the upper thigh. And this condition? It's known as a femoral hernia. And it all traces back to the specific anatomy of this tiny, vulnerable little canal. It is just a fascinating look at how our body's design is this incredible mix of perfect function and at the same time, these inherent vulnerabilities, which kind of leaves you with this thought, doesn't it? What other hidden gateways and potential weak spots are just sitting there, inside our own bodies, waiting to be understood?